Today I'm going to be walking you guys through a myelogram procedure. This is for a cervical myelogram. I've already got all our supplies set out and ready to go. So I have sterile gloves. I always have 2 packs. This is for the radiologist when he comes in. We also have betadine sticks. This is when the radiologist sterilizes the area that he's going to inject the needle through. And then we have 2 needles. One is an 18 gauge and a 25 gauge. And then I always bring out another needle. This is a 22 gauge, but it's extra long just because sometimes you need a longer needle to get into the lumbar spine area. And then I also have a 10 cc syringe. And then I have hemostats and a Sharpie, and this is for the radiologist to find the spot that he's going to go in through with the x-ray, and then he marks it with the Sharpie. And then I also have our sterile tray. I'm going to walk you guys through how to open this up and drop things on there for our radiologist. Always put your gloves on. These gloves don't have to be sterile. So you always want to touch only the outside of these trays. And you pull away from you. Because you're not sterile, you don't touch the inside. Sometimes these trays don't really behave, but that's okay. Because the radiologist can come in when it's sterile. So I'm going to drop these needles first. 6 inches above the sterile tray. Just drop it right in. It's okay, it doesn't have to be perfect. As long as it gets in that tray. If it drops on the floor, that's okay. We can just get another one. Just make sure you don't touch it because you're not sterile. And I always bring extra things out just to be extra prepared. Our lidocaine and our contrast ready to go. The lidocaine is just to numb the area. And then I also have everything set up on the table ready to go. I have this towel rolled up. It's for to elevate the chin on the patient. And then I have a pillow and a sheet always. And then I have a sponge right here. It's going to go, the patient is going to lay on their stomach, and this is going to go underneath their hips. Blockers. The patient's head is going to go through here and kind of hold the shoulders. Alright, we're going to go get our patient. Hi. Birthday? 10/7/04. Okay. And I'm just going to double check your wristband really quick just to make sure you are who you are. Alright, and anytime we're dealing with radiation, females of childbearing age, we always have to ask, is there any chance of pregnancy? When was your last menstrual cycle?
3 weeks ago.
Okay. So I do have this form for you to sign. It's just a pregnancy consent waiver, just stating that you're aware that you're going to be radiated today. And it explains the risks and everything if you were to be pregnant. So, are you familiar with what we're going to be doing today?
I looked it up a little bit prior.
So, I'll walk you through everything. We're going to be doing a myelogram for your cervical region, your neck. Can you tell me any kind of problems that you've been having on, like for your neck or your back? What's going on?
I think I might have injured it a couple of weeks ago. I was going on the run and I might have tweaked it a little bit. Yeah, just pain, limited movement.
How long has that been going on?
2 weeks.
Okay, so I'll walk you through what we're going to be doing today, just to familiarize you with it. So our radiologist is going to come in. He's going to be performing the procedure. I'm going to be assisting.
Okay.
You're going to lay on your stomach on this table, and then this little wedge right here is going to go underneath your hips.
Okay.
And then your head is going to go in between these 2 blocks right here.
Okay.
So the radiologist is going to lift up your shirt a little bit just so your lower back back is showing because that's where he's going to go in and inject a contrast. He's going to use these little betadine things to sterilize the area that he's going to be going in. And then he's just going to use a little bit of lidocaine. It's just going to numb the area. He always likes to say a pinprick and a bee sting, that's what it's going to feel like, but after that you shouldn't feel anything at all. And then he's going to use the x-ray to kind of figure out where he's going to go in, find the right spot, and he's going to mark it with this marker. And then he's going to take the contrast and use our little syringe and inject the contrast in through your lower back. And once that's in, we're going to lay you flat, and then we're going to tilt the table up a little bit. So you might feel like you're going to go upside down, but you won't fully. It's just to make that contrast go all the way up to your neck, because that's where we want it to be. And then I'm going to put this underneath your chin. It kind of elevates your chin a little bit, and that is just to keep the contrast from flowing further up into your head and irritating it.
Okay.
And this is just a consent form I'm going to have you sign, just saying that you consent to having this procedure done today. Do you have any allergies that we should be aware of?
I do not.
Any allergies to contrast?
No.
Have you had anything to eat or drink today?
No.
Are you on any blood thinners?
No.
Alright. And I also have this form for you to sign. I'll give you a copy of them as well.
Okay.
These are our Myelogram discharge instructions. I'm just going to read through them with you just so you know what to be prepared for and
Okay.
everything like that. So you have a driver for today, correct?
Yes.
Perfect. So you're not going to drive. You don't, just kind of take it extremely easy for the rest of the day. Go home and rest. It's important to keep your head elevated for 24 hours. You will get a headache most likely. That's normal. You can take ibuprofen or anything like that to relieve it. It's important for you to lay flat, elevated, don't move at all, just because we want to make sure that wound where the radiologist goes in and heals properly. If you do get a persistent headache, get some nausea, like a migraine, something just really doesn't feel right, just call your doctor, because that means that the wound's not healing properly, and you may have to go back to the hospital to get something called a blood patch to make sure that wound can heal the way it needs to. If you feel any weakness in your arms, legs, muscles, it's totally normal, that'll go away. Sometimes when the radiologist is trying to feel for the spot that he needs to go in, you might feel a little like leg twitching, numbness, something like that. That's normal. He's just seeing nerves in there. Sounds a little scary, but it's completely normal. Any questions? All right, I'm gonna have you sign this, and I'll give you a copy as well. All right, so I'm gonna go ahead and get you prepared for the radiologist to come in. I'm gonna go ahead and have you turn it onto your stomach. And then this wedge is gonna go underneath the hips. You'll look like I'm suspicious. And then your head is gonna go to the hips. And I can always adjust them. And your shoulders are gonna be right up at the top here. And I'm gonna lay this sheet over you, just so when the radiologist exposes your back, you're not exposed to the world. Your lower back. Your feet are up. Or your feet. The radiologist is getting ready to tilt the table forward. I'm going to stand right here just to make sure you're safe and fully supported. You're going to feel like you're going upside down. You're not going to go upside down fully. It's just to move that contrast into your neck.